So your kidneys are failing and your consultant has said to you that you need to start thinking about what type of dialysis treatment you're going to have should they continue to decrease and you reach the point where you're going to need that treatment. So it's just how I came to the decision of going down the hemodialysis route. So when my kidneys reached around 20% of function, my consultant gave me a load of information around the different types of dialysis treatments, told me to go away and read them, and then I had, a few, probably about a month or so to make a decision. You also get invited along to, well, especially where I live, I got invited along to some education afternoons where you would have people from the health service and patients who would come along and talk about the different types of treatments that they're receiving. Also transplant patients were there as well, which was useful information to hear as well. In my case, I decided to go down the hemodialysis route and receive that hemodialysis treatment via what is called a AV fistula. So I went back, I told my consultant that was my choice. Okay, and my consultant then said, okay, what will happen is now, when your kidney function reaches 14%, we'll send you to have the scans on your veins to make sure that your veins are suitable for having the fistula surgery. And then kind of didn't hear anything else on the matter until I did reach that 14%. I was then booked in. I went down to my local dialysis centre. I had a scan on my arm to determine whether the veins were suitable for the surgery. Initially they focused around my wrist area, as that was the preferred choice of where to have that surgery, and everything looked fine. No concerns. Was sent away and said, okay, look, when your kidney function reaches 12%, we will then go ahead with the surgery to create the fistula. So yeah, another few months passed, kidney function dropped again, reached that 12%, I was booked in, and I think within 3 weeks I had the surgery to create the fistula on my arm. So on the actual day of the surgery, you're a day patient in most cases. I arrived at the hospital, was checked in, and they performed a scan on my wrist of where the surgery was going to take place, but the surgeon on the day decided that the veins were not suitable in that area, so then scanned on the around my joint of my elbow, decided that the veins were much better suited in that area, got my consent to operate in that area, and away we went. I think the surgery lasted, for me anyway, including that scan and conversation, probably about 2.5 hours. I was put under a local anaesthetic for that time, so the whole surgery I was awake. Obviously couldn't feel anything because of the anaesthetic and the numbing. It was a weird sensation. You can feel them moving around. What's actually involved in the process is they'll take a vein and an artery and they'll essentially fuse them together to create like a kind of super vein that has very powerful blood flow. Yeah, surgery lasted about 2.5 hours, sewed me up, arm was a bit numb, spent another couple of hours just in recovery at the hospital, and then I was released and allowed to go home. Took about 2 weeks for it to properly heal and recover, but it was all working very well. You're told to listen out for kind of like a sound, and you will hear it. I can hear mine through my coat now, it's so powerful, and also to obviously feel it, and it's like a very powerful pulse that you can now feel in the area of where the fistula has been created. Yeah, and then you go back for a checkup at a dialysis centre a week later just to make sure it's all healing correctly, and then it was left. Mine was then left for maybe 4 months until I actually then started dialysis. So I will share a picture of it in a minute at the end of this video. It's a bit gnarly. Some people's go a bit like mine have, some people not. It's just the way it is. It's not aesthetically very nice to look at, and I do find myself wearing longer sleeve tops nowadays rather than t-shirts because it is a little bit, I don't like the look of it myself, but that's maybe just a vain thing, or a vanity thing. But yeah, any questions you've got about fistulas, leave them in the comments and I'll try and answer them. Cheers.